For this podcast, I'll be discussing my policy topic web review. My policy topic web review was on preventing HIV/AIDS in the United States. We will discuss policies created by federal, state, nonprofit, and higher education. First, we will be discussing federal government. I focused on two institutions within the federal government. The first is the CDC, the Center for Disease Control and Prevention, and the other is the White House Office of National AIDS Policy. The CDC doesn't really provide too much hands-on aid with regards to HIV/AIDS prevention, but they do help state and local governments build policies. They help educate the public by putting tons of information online, and they gather and disseminate HIV/AIDS data, and they also provide scientific research. We'll now look at the Office of National AIDS Policy, which is an agency within the White House that aids the executive branch in producing policies that reduce the number of new HIV/AIDS infections. Within this office is the National HIV/AIDS Strategy. One of their top priorities is to reduce the amount of new HIV/AIDS infections. To accomplish this, they implement policies that will increase HIV prevention efforts in high-risk communities and educate all Americans about the threat of HIV. We'll now focus on state government. Every state provides some sort of policy on HIV/AIDS prevention. I have chosen to focus on three states with the largest populations. They are California, Texas, and New York. In California, the California Department of Public Health provides citizens of California with valuable information to help prevent the spread of HIV/AIDS. Ton of information on their website, and they also created another website called the California HIV/AIDS Service Referrals, which pretty much helps people in the state of California find testing sites, and they also give some information about how to prevent HIV. For the state of Texas, the Texas Department of State Health Services helps prevent the spread of HIV/AIDS. They provide numerous brochures on how to prevent HIV, and they allow the public to order copies of these brochures free of charge so they could help educate others. Their website also directs residents to HIV testing sites. We'll now move on to New York. In New York, the New York State Department of Health provides tons of resources to help prevent the spread of HIV. They have numerous brochures, more than any I've seen on any other website, tips on how to educate others, and links where you could find HIV testing sites in the state. We'll now move on to higher education. Higher education provides many resources on HIV/AIDS prevention. One of the biggest services they offer is health services. Many schools provide HIV tests for free to their students, and you could just visit your school's health office and they'll be more than happy to provide you one for free. Another important aspect of higher education is research. Just to name a few, schools like Harvard, Columbia, Yale, they all provide some sort of scientific research into HIV/AIDS prevention. They conduct numerous trials on HIV vaccines, study the causes of HIV/AIDS. They also publish numerous articles to help educate people and help educate other scholars. We'll now move on to nonprofit organizations. They provide some of the most extraordinary work with regards to HIV/AIDS prevention, because most of the work, or pretty much all the work they do, is for nonprofit with no gain to them. Many parts of the country where HIV/AIDS prevention is scarce, they step in to make sure people are getting the right information and are getting tested. One of the largest groups is called AVERT. AVERT's main goal is to provide the world with free education on HIV/AIDS prevention. They also provide links to find HIV testing across the whole entire world. To conclude, the United States has been witnessing a decline in the rate of new HIV/AIDS infections. We could definitely attribute this to policies that have been put in place by numerous organizations, and we just need to make sure that we continue to follow these policies, implement new ones where needed, and also change them up if they're starting to get outdated.